Well, Albany Cardiothoracic Surgeons has prided itself on providing excellent cardiac surgical care for patients. We are the oldest practice for cardiac surgery in the area. We have been in business now for almost 60 years. We are on our third generation of surgeons. From the people who started, from the surgeons who started the practice back in 1955 to now. And I think the legacy has many factors to it. Part of the legacy is that each preceding generation of surgeons has found a social responsibility to provide excellent surgeons for the community. And excellent surgeons meaning not just technically proficient surgeons, but surgeons who are also compassionate, who understand, who are well trained.
The partners are all exceedingly well trained. I trained at Columbia, Dr. Terrien trained at Yale, Dr. Karavas trained at Vanderbilt and University of Pennsylvania. Dr. Saifi is actually trained here in the Albany, at Albany Med. So they're extremely well trained, and because we share the same values about patient care, there's sort of a seamless integration of care between the partners. So I feel, and I think we all feel, very confident about leaving a patient of ours in the hands of one of our partners, because we know that their commitment to that patient is as strong as our own individual commitment.
I consider myself very lucky to have the three partners that I have. We have a true partnership, which is not always the case in this discipline. But I have full faith in them and full trust, such that if I'm in the operating room performing an operation, one of my partners is out and available, they can tend to whatever issues any one of my patients may have, even if it's just answering a question or speaking with a family member.
I think I learn every day from my colleagues. We go through all our surgeries every week. We discuss every single case every day, and we learn from each other. They all have different backgrounds, which makes everything more diverse, and we have options to provide the best opportunities for treatment to our patients.
I think in terms of what we deliver to the patients, and what I feel I deliver is really a very personalized care. As a group, we really do care about our patients. I think one of the things I like the most about my partners is the fact that we cover each other on weekends, so everybody isn't on every weekend. But on any given weekend, every single one of the partners will either call in or come in to check on their patients, even though they don't have to. And I think that underscores the value or the commitment that we have to taking care of our patients. Even though we know they're getting perfectly good care when we're not there, we still are engaged in every aspect of their care because of our commitment to them.
Well, we have a very good, experienced staff. Many of them have been with us for many years. They're very knowledgeable in handling everything from patients' first entrance into the office, appointment setups, billing, helping set up. The hospital has various educational programs and helping them get oriented to those educational programs. I think it's very important for the patient to be comfortable with the staff. There are always questions to be asked, things that are sometimes uncertain even after the initial meeting, even after discharge, and the office staff is their gateway to getting those questions answered.
It's almost a family unit here. We have a wonderful cadre of physician's assistants and nurse practitioners, which function as our assistants and essentially physician extenders. They're all very experienced. We work very closely with them, and there's literally no boundaries between communication with them and their access to us.
Our staff share our values. I mean, I think we are all committed to patient care, and everybody from the secretaries on through to the physicians all have that same value set. So I think it's an easy office to work with in some ways because the staff understand what the patients are going through. They take the time to listen to them. It's really great that the whole team shares that same value. I really do enjoy taking care of patients. I enjoy the interaction with them. I enjoy the satisfaction of knowing that you've done a good job and seeing them 2 weeks later and they look like a whole different person. I think that is, there are not too many jobs that allow you to do that. And there are not too many even fields in medicine that allow you to do that.
Seeing the patients getting out of the hospital with a smile, and being able to see them in our community, having back their life.
I think the community here is one of the most appreciative communities in which I've ever worked. The patients are very appreciative of the care they receive, and it's unbelievably rewarding to get some of the cards and thank you notes.
One of the most rewarding aspects is to see somebody who has their activity levels have been limited, and after the surgery to see them bounce back to full activity. I think that's one of the most rewarding things, and that's what we strive for. We want to get people back to fulfilling their lives in a way that they would like to.